Hi, this is the second video in my series that I'm creating for the students to go over each aspect of the head-to-toe final testing that you'll be responsible for at the end of the semester. Hopefully break each piece down. I'll talk about how you do things, why we do things, and then actually demonstrate it on my patient Anna here. What I recommend is to refer to Canvas, pull up the head-to-toe grading rubric that's on there listed, because this is what we actually use when we get ready to grade you at the end of the semester, whether you pass, fail, the head-to-toe. So follow along on that. So for the second video, again, we're going to use the same patient, Anna. She's going to follow us through the whole video series here, and I appreciate that. I'm going to start out by, again, washing my hands to begin with. And we've done the initial general survey and mental status and vital signs on the last video. So we're going to pick up this video with head, face, and eye exam, and I'll talk through those. So, hi, Anna. Hello. So I'm going to start with her head, and again, anytime you start any sort of assessment, we start with inspection. If you're using your eyes, you're just looking first. For her, looking at her head, and again, her hair, we are looking for hair distribution. We're looking for cleanliness. Is it greasy? Is it clean? Does she have some bald areas, any thinning areas, things like that? As well as when you're inspecting, you're looking for any open sores, lesions that you might want to further investigate, and any bugs that you might see, which include lice or anything like that. So again, inspection, I'm just looking with my eyes. I then move on to palpation. That's where I'm using my hands to feel. Now that I've looked, I'm going to feel now, so I'm going to palpate her head here. And again, you're just feeling all around, and you want to ask if there's any tenderness. You're feeling for lumps and bumps, any of those open lesions you'd want to examine further from here. So any tenderness with that? No? Okay, so that's her head or her hair piece of the assessment. We're moving systematically down, so then you look at her face, the things, again, upon inspection that I'm looking at. Symmetrical features are her eyes and her eyebrows, symmetrical, her nose midline, her mouth midline, things like that, again, so upon inspection. Any open sores, we're looking for assessing the skin, does she have any rashes, anything like that that you'd want to further investigate, because skin is something we're going to assess throughout, like I had mentioned earlier. So face, her eyebrows, and her eyelashes, again, nose and hair distribution, those are equal. Her eyes are equal, her nose is midline, and her mouth is midline. We then move on to cranial nerve 7. You will be expected to know the cranial nerves, the names of them, and how to test for each one of those. And I'll go through all those, and we'll talk about that through these videos. So for cranial nerve 7, that is the facial cranial nerve, which controls facial movement. I'm going to give her some instructions that I need her to do to be able to assess cranial nerve 7. Can you smile for me? Can you frown? Can you puff out your cheeks? Can you raise your eyebrows? Can you stick out your tongue? Excellent. So those activities that I had her do, again, assesses for cranial nerve 7, which is obviously intact. Moving on to cranial nerve 5, which is the trigeminal cranial nerve. This is tested for sensation. So what we want to do, again, on the face, we're going to assess sharp and dull. We're going to use a safety pin. You can use anything that gives that feeling of sharp and dull, but safety pin works well. You're going to have the patient close their eyes. Again, this is a sensation sort of test. You're going to demonstrate to them prior to starting, what does sharp feel like, what does dull feel like. So I like to do that on their arm so that they can have a good feeling. So this will be sharp, and this will be dull. Okay, so have you close your eyes. So what I want you to do is tell me sharp and dull, and where it's located, okay? Sharp on my cheek. Dull on my chin. Sharp on my forehead. Dull on my other cheek. Okay. So that assessed cranial nerve 5, which is the trigeminal, and obviously intact. She did a nice job with that. Now we're moving on, again, still on the face area. Another thing that we're going to want to palpate while we're right here is the temporal arteries. Those run along the outside of the eyes. Again, when you palpate, you want to use the pads of your fingers to be able to feel. So you're palpating for elasticity and any tenderness. So as I feel, they're symmetrical, they're equal. Any tenderness when I do that? She has 2+ pulses bilaterally, which again is another normal finding. Now I'm moving down to her eyes, the things that we look for in their eyes upon inspection, the placement on their face, the outer canthus of the eye should line up with the top of the ears. The upper eyelid should cover 1/3 of the patient's iris, which hers does. Again, looking to make sure that they're symmetrical. You're looking for any sort of droop of the eyelid or anything like that that you would want to further investigate. Hers are all equal, so she has normal inspection of her eyes. Some testing that I will do for eyes include cranial nerves, and we're going to test cranial nerve 3, 4, and 6, which 3 is the oculomotor, 4 is the trochlear, and 6 is the abducens. With this test that I'm going to do, and it's extraocular eye movements. It's how they track an instrument with their eyes without moving their head. So her instructions would be, I want you to watch this pen light, follow it with your eyes only without moving your head. Start midline. Back midline and then converge to the middle, watching her eyes. Again, those are the eye movements, the eye muscles within the eyes, that they're able to do that without having to move their head to be able to see it. You make a big H, basically, and they're able to follow that. So that's testing 3, 4, and 6. Another test for cranial nerve 3, which is your oculomotor cranial nerve, is pupillary response to light and accommodation. To do this, you want to make sure your lights are out because you're going to be watching the response to light with her pupil, so you need it to be darker than you normally would. So you turn the lights out if you haven't already done that. And as I have her looking straight ahead to me, I have my pen light in hand. I want to put a bridge in the middle, and that way it's not interfering with that eye, and I'm able to better assess. So I put my light out here, I come in from the side. The first time I do it, I'm watching the eye that I'm testing. The second time I bring the light in, I'm watching for the pupillary response of the other eye, which should be equal. Okay. Again, you look at the pupils should constrict with light, and then the other pupil should as well constrict equally when the light is shown in that opposite eye. And again, you want to compare both sides. Excellent. So that is pupillary response equal and accommodating to light, cranial nerve 3, the ocular motor. The other test I'm going to do is the corneal light reflection test. I'm going to instruct the patient to look over my shoulder. I'm going to shine a light into their pupils. What you're looking for is a reflection back. You want to make sure it's equal within both pupils. So look straight over my shoulder. You shine the light at the bridge of their nose. Again, look in their pupils and for the reflection of the light, and hers is equal in both pupils. That is the corneal light reflection test.